I'm Courtney. I'm the student nurse today. Can you tell me your name and date of birth?
Jagger Hartshorn, September 5th, 1998.
Okay, perfect. So what I'm going to do today is start with your head to toe assessment. So I'm going to go ahead and wash my hands and perform my hand hygiene and put my gloves on. Okay, can you tell me what your name is again?
Jagger Hartshorn.
Okay, and do you know where you're at?
Jacksonville, Alabama.
Do you know what today's date is?
It is September 29th, 2025.
Okay, and do you know why you're here?
For my head to toe assessment.
Okay, so you are alert and oriented ×4, so you know the person, place, time, and the situation. So you are alert, your speech is clear, and you are following commands. So you do respond to verbal stimuli. So what I'm going to do now is I'm going to start the head to toe assessment. So to do that is I'm going to check your pupils. So first we're going to look at the pupil size. Okay. Looks like your pupil size is about 4 millimeters, so that's around average. Now we're going to see if they are equal and round. They are equal and round on both sides. So now we want to see if they accommodate to light. So we're going to check the light reactivity. So what I'm going to do is come in from the outer eye into the inner eye to see if there is constriction. Yep, there's constriction over here. Let's check over here. Perfect. Okay, and now what we're going to do is check the accommodation. So can you stare at this wall for me for 30 seconds? Okay, 30 seconds has passed by. What we would be checking for right here is if the pupils are dilating, which they are. So now what I'm going to do is get you to stare at this pen. Right here we're looking if the pupils are constricting again, which they are. So if you can just follow the pen to your nose here. And right here we're checking for convergence, which is what's going on. All right, so now if you can lay back in bed for me. So now we're going to start this other assessment. All right, so right here first I'm going to check the skin turgor. So I'm going to check here on the collarbone. If you can take your shirt off for me. Alright, so I'm going to check the skin turgor on the collarbone. Okay, so it does recoil quickly, which is normal. So now I'm going to inspect the thorax for any use for accessory muscles. So that's what I'm doing right now. So there's no sign of respiratory distress and there's no use of accessory muscles, so we're good there. So now we're going to check where the heart lies to make sure there's not any extra palpation over here or any extra bulging. Okay. All right, so that's good. Now we're looking at the abdomen and we're inspecting this for the shape of the abdomen and seeing if there's any bulging, which there isn't. So now we're going to go ahead and auscultate the heart. So to start with that, I'm going to go to the right side and check the second intercostal space, and I'm listening for my love dub. So we're going to find the second intercostal space, which is right here. And I do hear my love dub. So then we're going to go over and go to the left pulmonic valve, which is also the second intercostal space. Okay, then we're going to go down to the third intercostal space and listen for the Erb's point. Then we're going to go down to the fourth intercostal space, and this is listening to the tricuspid. And then the fifth intercostal space, and this is going to be in the left midclavicular line, and this is the mitral valve. So this is where the apical pulse would be. And we do hear the love dub. Alright, so I'm going to turn this around to the bell side and listen in the same exact places. So right here I'm listening for a heart murmur and I do not hear one. Okay, so So the heart sounds good in all of those locations. So now we're going to start our lung assessment. So for here, we're going to start above the right clavicle and we're going to listen for a full in and out. Alright, so we're going to listen at the right clavicle. Okay, and then we're going to listen to the next side to compare. And we're going to go back and forth. So far, the breath sound is clear bilaterally. So the respirations are regular and unlabored. So there's no cough or shortness of breath noted so far. And we're going to go around the side of the lungs to make sure we get the full lung base. Again, listening for the full in and out. Alright, so the lungs sound good on the front. So if you can sit up, I'm going to do your posterior side. Okay. Alright, so we're going to do the same thing on the back. Start up at the shoulder. So I'm listening for labored breathing or wheezing and going for the full lung space. So I'm going to avoid asking my patient to breathe in and out so they do not hyperventilate. But if I'm having troubles hearing a breath, I will ask them to breathe for me. Okay, so that sounds good. So now if you'll lay back down, I am going to listen to the vowel sounds. So for this part, we're going to divide the abdomen into 4 quadrants. So we've got 1, 2, 3, 4. And we're going to start listening to the right lower quadrant. And we're listening for a gurgle or any kind of, we want to make sure that there's vowel sounds in there. So listen to the right lower quadrant. Okay, then we're going to go to the right upper quadrant. Left upper quadrant. And left lower quadrant. So I do hear gurgling, so that's good. So now that I've listened to make sure that there's no abnormalities, now I'm going to begin to palpate this 4 quadrants. So we're going to do that with a circular motion with all 4 fingers gently pressing down. Do you feel any pain or tenderness so far?
Nope.
Okay. Now we're going to feel for a distended bladder, so we're going to do it the same way. And that feels normal. Okay, now I am going to ask you some questions. So when was your last bowel movement?
This morning.
Okay, and what color was it?
Brown.
And was it solid?
Solid, yep.
Okay. And when's the last time you urinated?
Half an hour ago.
Okay, what was the color?
Late yellow.
Okay, perfect. So now what I'm going to do is I'm going to inspect the skin, which I was doing during my head to toe assessment already, but we're going to inspect the skin and make sure there's no abnormalities and everything looks good. And then we're going to go down and we are going to palpate the radial pulse, and we're just feeling. So this is about a 3+, almost bounding, but not quite. Alright, now we're going to check the finger for any cyanosis or discoloration. So there's no cyanosis noted to the fingernail beds, and also didn't see any around the mouth or around the ears. So now I'm gonna check the capillary return. Okay, and that was less than 2 seconds, so that's normal. So now can you squeeze my fingers? Okay, so he's doing that pretty good. So now we're going to work our way down and inspect the legs. Sorry, inspect the legs. Everything looks good on the legs. And we're checking for any edema or anything right here, and there's no edema in the legs. All right, now we're going to palpate the dorsalis pedis. I would say this one's about a 2+. And again, no cyanosis. So let's go ahead and document that. All right, now I'm going to go to the other side. And again, I'm inspecting the arms, making sure everything's okay. And then I'm going to palpate the radial pulse. I would say this one is about 3+ as well, almost bounding. Okay, so everything looks good here. And there's no cyanosis. Let's look at the capillary return. So less than 2 seconds is looking okay. Now we're going to look at the legs. Everything looks good with the legs. And now we're going to palpate this dorsalis pedis over here. And that's going to be up on this bony, this prominent bone up here. So that one's about a 2+ as well. Okay, now we're going to check the strength towards the back of the legs over here. So if you could just push up against like a gas pedal. All right, so there, he's pushing pretty well, so he's not having any problems with that. And you can go ahead and sit up for me and put on your shirt. And that concludes our head to toe assessment for today. Thank you.